Live talk show where community and support. Welcome to Fertility Village. This is your weekly live talk show where community and support come together. With rotating hosts, expert guests, and meaningful conversations, we're here to guide you through the highs and the lows of infertility. Whether you're searching for answers, seeking advice, or just looking for a special place to belong, Fertility Village is your space to connect, learn, and grow. Because it really does take a village, and we are here for you every step of the way. Thanks for joining.
Hi, everyone. Sorry that took a minute. Welcome to Fertility Village Live. I'm Sarah, and I'm welcoming tonight the very amazing Dr. Caitlyn Keates. Welcome, Caitlyn.
Thank you. Hi, everyone.
Hi, we're talking all about naturopathic medicine when it comes to fertility. So I'm so excited to dive in. Remember, if you're watching live and you have some questions, just shoot them in the comments and we will ask them live here with Dr. Caitlyn. So first, Caitlyn, tell me a little bit about yourself and what interested you in naturopathic medicine.
Yes, so I am a naturopathic doctor. I graduated in 2020, so I've been practicing for a few years now. And I just actually joined the board for Oasis as well. So I'm very excited to be able to contribute to that community in any way that I can. And I guess personally, I used to be a national team gymnast growing up. I am a hockey wife as well. My husband plays hockey overseas. I'm a dog mom to a Frenchie, and I just became a real mom as well back in March. So I'm very excited about that too. A beautiful little boy. But my clinical focus mostly is women's health related, hormones, fertility, reproductive health. I like looking at the whole picture of a person rather than just like one symptom or one diagnosis. And I guess that kind of stems from when I was like a national team gymnast, right? We always kind of fascinated by how the body is interconnected, nutrition, stress, sleep, hormones, all of that, and how that can influence how someone feels. And then fertility became more of an interest of mine, or more women's health, just because like I'm a big girly girl and I love supporting women and advocating for them. And I feel like it's not very prevalent in medicine right now. So I'm hoping to be a voice for a lot of women in the fertility space, but in women's health as well in general.
Love that. I am all about my lady doctors, honestly. It's been a long time, but I think I have all lady doctors now. So I appreciate you. And again, that focus, I feel like it doesn't come unless you're a woman. So
yeah, exactly.
Again, and I appreciate that whole health aspect when it comes to naturopathic medicine. It really makes me connect with it when my doctor is looking at that whole picture and not just one little snippet of it, right?
Right.
That's perfect. So can you explain a little bit like what a naturopath does and how does your approach differ from like a conventional fertility doctor, fertility specialist? How does it differ?
Yeah, I think there's actually quite a lot more overlap than some people realize. I've also personally gone through the fertility specialist route as well. So I've been a patient, but I've also worked with them clinically too as a physician. So I think the fertility specialists, they're incredibly important for more diagnosing and treating a lot of medical causes of infertility. And there's certain things that they can do that a naturopathic doctor just, they simply can't do, right? So we fit really nicely alongside that care. I think we look more at like nutrition or lifestyle or menstrual patterns, metabolic health, certain other factors like stress or sleep that can be contributing to someone's overall health. And we just have a lot more time to look at the overarching picture of a patient rather than those specific diagnostic criteria that a fertility specialist would go through. So yeah, I think both professions kind of bring different tools, but like to the same team.
Absolutely. I love that team. I'm going off script a little bit here, but I was once told, like, when looking at blood work, like a medical doctor who is looking at, when you look up your labs, it's like within normal range, like here's the normal range of things.
Yeah.
A naturopathic doctor will look at those a little bit differently. And even though something falls in a normal range, you see it differently. Can you explain
100%. Yes. So I always say to patients, there's a range that we reference or that you should be in. And then there's an optimal range. And that optimal range can be a lot smaller than what the range looks at, or a lot larger than what the range typically would look like. An example would be the thyroid range kind of goes from like 0.5, 0.8 all the way up to 4 for your TSH value. But for a pregnancy, we want to see your TSH less than 2.5 to help you get pregnant and stay pregnant. So that's the optimal range that we need that TSH value to be in. So that's just an example there.
That's a perfect example, because I think that's the one that my naturopath pointed out, like, well, yes, it's within normal range, but not what we want to see.
Right, exactly. Yeah.
Amazing. Who would you say typically comes to see you? Is it people just starting to try, people with unexplained infertility, or those already undergoing IVF or IUIs?
Yeah, really a broad spectrum. You can start to see a patient start like when they're starting a family and they want to optimize their health kind of before that whole process starts, or patients who have been trying for a while without success, or people with specific conditions and they're worried about their fertility, like a patient with PCOS or endometriosis, or people who are already working with a fertility clinic or just starting to work with a fertility clinic as well. And then lastly, I would say a lot of that unexplained infertility, those patients will come in, they'll want to kind of take a deeper look at what might be going on. But yeah, you don't necessarily have to wait until there's a fertility issue before you start thinking about reproductive health and when to see a naturopath.
That unexplained infertility is like probably the most frustrating one as a patient. Because most of us, I think, start out there, that unexplained infertility. Like, again, those fertility doctor specialists don't have an answer for us. Yeah. And that's so frustrating. So do you happen to see, like, when someone comes in with unexplained infertility, do you ever like see any flags off the top of something that you should look into more, like, oh, these are flags of the PCOS or PMOS, whatever it's called now, or endo or things? Like, are you seeing that maybe over some of the fertility doctors sometimes?
Sometimes I would say a lot of times, like if we were to approach that, how we approach that unexplained infertility, it might be different than the way the specialists, they'll say, we don't know why you can't get pregnant, right? Unexplained doesn't necessarily mean that nothing is wrong. It means that, like, based on what they've tested, they haven't identified any obvious explanation, right? So that's a important distinction there. So we like to kind of look at the overall picture again. Are you ovulating? Cycles normal? What does sperm health look like? Thyroid concerns, like we were just talking about. Is there maybe something on the ultrasound that they're missing as far as like tubal factor, or is there some sort of endometriosis or follicles that look excessive, suggesting that PCOS might be a concern there? So just doing like a really deep dive into that again, just making sure everything, T's have been crossed, I's have been dotted, and everything's been looked at before we assume, despite everything right, there's no like simple explanation why fertility isn't happening.
Yeah, it's never, again, never too early, right?
Yeah.
So that kind of leads to my next question. In an ideal world, when would you like to see someone who is potentially thinking about becoming parents or trying naturally? When would you like to see someone
Yeah.
Prior even to their fertility journey?
Right. So as I guess there's a standard and there's a naturopathic standard again. The standard that the medical system recommends is to try naturally for 12 months if you are someone under the age of 35. If you're over 35, they say 6 months. And sooner if there's any known risk factors or concerns based off of maybe there's been some abdominal surgeries or autoimmune diseases or something like that. So that's the standard with them. As a naturopathic doctor, if you're thinking of getting pregnant or wanting to become pregnant within the next 6 months, I would say that's a good time to come in and look at what is going on as far as your health, talk about your cycles, look for any nutrient deficiencies, talk about your lifestyle factors before you're even actively trying and going on a proper dietary lifestyle supplement regime before you even start.
Right. It's funny that you said if there's any diagnosed or any suspected, issues beforehand, but how many times have teen girls and things have PCOS or have endometriosis and they don't know until they start trying, or they've been trying for 6 months or they've been trying for a year and nothing's happening. It isn't until people get into that they find those things out, right? So seeing a naturopath is probably going to be very helpful. I've told my friends who have teen daughters and they're like, oh, she has such bad cramps. I'm like, you know what? Go see a naturopath. And if you really need to, I think you should go see an OB. They're 18, they need to preserve their fertility. Go find out how to help these kids earlier than later when they're
exactly. I've seen AMH values, which is the anti-Mullerian hormone. We can talk about it a bit later too. We talk about testing, but that value, I've seen it low in women who are in their early 20s. And of course, we'll talk about more. It's not a predictor of fertility, but it might be something to think about if that value is tested earlier than later. And yeah, we can see that in those patients with PCOS.
Exactly.
I know.
Yeah. Well, we can jump right into that. So when it comes to things like the PCOS or the endometriosis, inflammation, insulin resistance, how do you approach those underlying factors that may have shown up in those initial blood works, or again, those early signs of diminished ovarian reserve in the AMH?
Right. So typically from a naturopathic lens, they're looked at as kind of overall metabolic or hormonal picture rather than isolated problems. Example, if we're talking insulin resistance, which is very commonly found in someone with PCOS, that can affect ovulation. Thyroid function can affect menstrual cycles. It can cause early or recurrent pregnancy loss as well. So that's something we want to identify and appropriately manage even before you are thinking of getting pregnant. Same with inflammation. We always want to find what is causing this underlying inflammation rather than just throwing anti-inflammatory diet at you or omega-3 because it's a natural anti-inflammatory supplement and building up that supplement regime too much. But yeah, inflammation is kind of a cause of autoimmune diseases or endometriosis or something like that. So we just want to look at those pieces and figure out if there's any isolated problems first.
I love that. I like to say my fertility journey was a while ago. But when I started seeing a naturopath, she kind of tricked me into anti-inflammatory diets and things that were going to help me without saying, this is what you need to do. This is that. You have inflammation, you have this, you have that. And it was very like a slow process. And it wasn't just throw the supplements and away we go. It was try this, try doing this first, see how you feel, come back. Like it was very, as I said, whole picture. And as I said, I felt like I was tricked, but it was so effective. It was so effective in feeling better and again, getting better results and things like that. So I love it. It's fantastic. What are some of the biggest factors that influence fertility, both for men and for women? Because I know we talk a lot about women's health, and again, that's your specialty, and we love that. But is there also anything for men that they can consider when seeing a naturopath?
Yes, I always say, and I emphasize that fertility is usually a couple's issue. It's not just a woman's issue. So whenever I am seeing a female for any fertility workup, I love their partner to be there or to do a workup with them as well, because they both deserve the same evaluation, especially in infertility cases. But when we're thinking of the biggest factors for women, usually we think about ovulation. A lot of women, they think, oh, I'm menstruating, I must be ovulating, which is not the case. You can menstruate and not ovulate. A lot of women don't know when they ovulate too. They think I ovulate day 14 of my cycle, which we don't really. A lot of women will ovulate really late or really early. So testing that LH strips just to see where your ovulation even is. But ovarian reserve is a big one. Age, also things we've talked a little bit about already: thyroid function, metabolic health, insulin resistance, what diet looks like, enough protein, really high inflammatory diet, and then like underlying factors, endo, sleep, stress, occupation. Those are really important for women. Same with men, but men usually more so thinking about like sperm health, obviously, getting sperm count, concentration, motility, and morphology looked at. So those are the big four. But for them too, we're always emphasizing things like smoking, alcohol, heat exposure. Their insulin does have a factor too, so metabolic health also important for them. And a lot of times too, we're going through medications for men, and just making sure there's not certain medications that they're taking that can affect their sperm quality as well.
It was a big conversation with my husband back in our day. Again, it's like, why do you drink way too much coffee, honey? Like way too much coffee.
Coffee is a big one. Alcohol is a huge one as well.
Especially when they're like, it's just when I'm out with the guys, I'm just when I'm playing that sports once a week, and it's like still binge drinking the problem.
Even sports, right? Like my husband being in the hockey world, we see a lot of like contact sports or wearing a jock strap every day or things like that, right? That can affect the motility or anything. Heat.
Hot tub was the other thing. He did not like me saying, don't go in the hot tub for a few months. Like, just give it a rest. Let's cool things off, right? It's funny, those things that, again, we don't necessarily think of in our everyday life. It's just living our life. When it comes to fertility, they really do make an impact. And we did see a difference in counts and things when he cut back on some of that. So men out there, remember, it's for you too. Check in, find a naturopath.
Exactly.
Is there anything that you would say that fertility clinics might overlook that naturopathic care can help address? So outcome focused. Do you know what I mean? And like, of course, like when we're in the fertility world, that live birth, that's the outcome, or the pregnancy
exactly.
And that's where they're getting to in terms of quality over quantity, maybe in number of eggs. I
would say the fertility clinic is more, the process is the ovulation, egg retrieval, fertilization, embryo pregnancy, right? Like those are their kind of stepwise focuses that they're looking at. more naturopathic, what we can kind of help with is more of that foundational health piece. So, for example, like what does somebody eat every day? Are they getting enough protein, enough macronutrients? Are they sleeping? What does their menstrual cycles actually look like? We've talked about like thyroid and stress already, but those we can all help with that maybe the fertility clinics aren't emphasizing as much because they're just more so narrowed in or focused on the ovulation and the egg retrieval and creating a clinical pregnancy there. So
yeah, I love that you said that, because a couple, again, early in our journey, and I'm an open book. We switched clinics at one point, and I remember my original clinic, they controlled the cycle, right? So it didn't matter really. They're like, call on day one, it doesn't matter. But in my case, I had undiagnosed PCOS at the time. So my cycle was really long, and I'm like waiting, it's waiting. And the stress from waiting is causing me more stress because I'm waiting for my day one to report. And so then they just give me a medication, right? So it was just that, again, it didn't look at the bigger picture. Well, we'll just give you a medication and let's get the ball rolling. And additionally, when I went into my final embryo transfer at that clinic, I had a full out anxiety panic attack waiting for that embryo transfer. And they're like, it's okay.
Yeah, well, exactly. And that's where the naturopathic doctors can really come in too during that situation, and anyone who's going through IUI or IVF cycles are very stressful, very demanding for both you and your partner. And that is, even if we don't take any supplements during those transfers, just helping you manage stress and sleep, really encouraging those aspects.
And bringing awareness even just to it. Yes, we know it's stress, but again, how can we manage that in the broader scheme of things? And is it a melatonin gummy to help you sleep, right? So anyway, so again, that's something that came back to my story and how a naturopath helped me going into a new clinic and a new round and all of those things that my first clinic just really didn't see at the time.
Well, I'm glad you recognized it and you switched. Sometimes you have to switch, and that's totally okay. You have, again, advocate for yourself and what you feel is best and most comfortable for you going through that journey.
Completely agree. And again, my naturopath, big shout outs to all the naturopaths. I find they do help with that advocacy, and again, that whole big picture, and not just that medication or the outcomes. So again, I always appreciate that. What are some signs that a person's hormones or maybe menstrual cycle may need further investigation? Again, we talked a little bit earlier about these teens and things like that. When for people that are looking or have nieces or family that are, they're on the journey and they think these people should look into it. What are some signs for those people?
Yeah, I would say really long cycles, longer than 35 days, really short cycles, less than 21 days, bleeding for a really long period of time. We shouldn't be bleeding for longer than, heavily for longer than 7 days. Bleeding in between the cycles, mid-cycle spotting, really bad pre-menstrual symptoms, PMS, PMDD, that's not normal. Really painful menstruation as well. Those are all red flags to me as well. Seems like PMS or PCOS, we see a lot of rapid weight gain, acne on the face, facial hair growth. Sometimes we get a buffalo hump on the back of the neck as well, or darkening under the armpits or in the groin region. But those would all be signs that there might be something hormonally off before you even think about fertility as a concern there.
Now, I learned, again, back in my teens, when you have these problems, they just put you on birth control and you think, oh, this is leveling it out, right? And then you get your cycle, every 21 days and it's 7 days on the dot because you're back onto the next pill. What do you say to people that are on the pill maybe or on some sort of birth control and they're thinking, oh, this is a correction?
Yeah. It is just a mask for sure. Sometimes, like clinically, it is relevant to be put on the birth control. And I always say, if that's your decision to go on, then 100% you can do that. But there is other things that I always encourage you to look into what is actually wrong before you go on those conventional methods. Because oftentimes I'll see a patient come in and they're already on the birth control pill, and then you can't really understand what's going on. I can't test your hormones. Even if we did an ultrasound, everything's going to kind of look normal because we're suppressing ovulation. So sometimes we don't see any follicles or any endo and whatever we might see on the ultrasound that we're looking for. So I always say there are other things that we can look into. Test your hormones first. Test them at the right time of your cycle. That's really important to emphasize as well. Not just randomly going. And then understand why you're feeling the way you're feeling before you make a decision on how to treat it, whether you want to treat it naturally or more conventionally with the birth control pill, because it will help you clinically in the long run, especially for fertility too. Once you come off that pill, you'll know what you're dealing with too.
Yes. How long after someone comes off a pill should they do those tests, do you think? Would you say in your happy world?
Yeah, typically we have to wait about 3 cycles for you to start kind of menstruating more regularly again, and your hormones to level out to their new baseline or new normal. So I usually don't test any earlier than 3 cycles post OCPs.
Thank you. What fertility test do you think people should know about?
I guess the most common one is the AMH. So I get a lot of people who come in and they want to test their anti-Müllerian hormone. Maybe it's like a TikTok thing lately. I've seen it a lot more frequently now, but that's the anti-Müllerian hormones it's looking at. It'll kind of spit out a number that tells you how fertile you really are. Like, not really though. It's not a predictive factor. It can be elevated in people with PCOS. So it can kind of give us a false narrative onto what exactly is going on. But it does, if it's really, really, really low, then usually I explain to patients, we don't like to see it low. So that might be a warrant to go to a fertility clinic and kind of look into why is this AMH low, and try to explain that a little bit better there.
Perfect. When someone comes to you and again, they're wanting to optimize their fertility, maybe they've done a few tests and what does your first assessment typically look like when a patient walks into your office?
Yeah, I don't know if I think you've done a naturopathic visit, but for who haven't, it's long. It's at least a good hour and a half long, and it looks at everything. So we're diving into your past medical history, your menstrual history, of course, very important in fertility. We're looking at diet, sleep, stress, what you do for work, your family medical history, medications you're on, supplements you're taking. So it's a long appointment, and that appointment too, we're also giving usually a treatment plan as well. So explaining what we want you to do after that first visit, in between to the second.
That's so great though, because again, yes, I've seen naturopaths before, but it's nice to be seen. Like, it's not a 10-minute virtual appointment. It's in depth. And again, things you didn't necessarily consider. As I said, I'm an open book. My family's an open book, but asking about like female health in my family. And I was talking to my family and it found out like almost every woman in my family has a history of miscarriage. So like, that's something to consider. And when I was going through it, that my family is known to have miscarriages when they're family building. So and again, something that I didn't know to ask or consider, but came up after, right? So
yeah, exactly. Family history can tell us a lot, that's for sure. We oftentimes don't think about that. I see it in a lot of menopause too. A lot of women won't ask their moms or grandmas what they went through as far as menopause goes, and the hormone health, it trends down the line. So it's important there too. And two, like a lot of women are coming in with many tests already done through the fertility clinics too. So we're browsing through those and just making sure everything's been tested and filling in the gaps if we need to as well.
yeah, absolutely. When I first saw a naturopath, I the first one we went to for fertility didn't necessarily jive with. She was like, here's some supplements, see you later. And there wasn't really any follow-up. So how do you approach supplements without falling into that like more is better trap?
Yeah, the supplement game can be really overwhelming for patients. I mean, for me, it's overwhelming to keep up with all the different brands that are coming out with new things all the time. And I mean, some women, they'll come in and they'll be on so many supplements already, and we're going through and taking them off of them, because there's no one magic pill that's going to make us pregnant or really give us the most optimal
Whoever
chance of
figures that
conception.
out is
Right.
going to be a billionaire, but that
Yeah.
would be great. But no.
Yeah, but there are certain supplements that have been well researched clinically that I think all women should be taking in that 6 to 12 months before conception even begins. So putting them on that, and then anything else would be just for if there is a clinical explanation for it. So an example would be a lot of our PCOS patients, they're on inositol, right? If their insulin is really high. So we're considering putting that in to help with their ovulation and getting a clinical pregnancy there.
Is there a way you balance that with what supplements, again, their fertility doctor specialists are putting them on?
Yes. So I always say, first and foremost, I don't want to override what they are recommending. So we'll go through what they're recommending, making sure the dosages are right. For the most part, the fertility clinics are really good at recommending the same things. They have usually prenatals in there, they have omegas in there, vitamin D in there, sometimes iron if the iron is really low as well. So we usually are on the same page. They're not going above and beyond. Some fertility clinics, they'll put in like coenzyme Q10. That's a big one as well. But yeah, for the most part, I always go through what they're recommending, and I'll say, this is what we'll go through the dosage that's appropriate and why they're taking it and how, like when they should be taking it, because oftentimes the fertility clinic's not telling them that. And then saying, this one's really not doing much for you, but the fertility clinic kind of recommended it. So leaving it in their hands to make a decision whether or not they want to continue it or not. But yeah, that's usually how I'll approach what they're recommending there.
Love it. In addition to that, when you're recommending supplements or any sort of naturopathic care, playing alongside, again, we've talked a lot about alongside the IVF and IUIs, but those ovulation induction medications, those medications, how does that play alongside what you do?
Yeah. So typically in that process, that's what I was saying. We kind of just take a little bit of a step back from, you're already doing so much during that window of time as far as like more conventional based prescriptions and medications there. So we don't want to overwhelm you too much, and we want to allow the medications to do what they're supposed to do. And just because it's a natural product doesn't mean that it's not going to interact too, right? So we do have to be cautious of what we're adding in while you're on those medications at the same time. But yeah, usually we're supporting more like the sleep and the stress, like I was saying, and letting kind of the medications do their part during that window of time. And then we'll come back and we'll add in the supplements again after everything has been completed there.
Awesome. Switching gears a little bit, I want to talk a little bit about recurrent pregnancy loss. I find that's more common. I'm seeing more in the groups. Like, and I don't know why, I was recurrent pregnancy loss without a lot of answers. So what factors should people ask their healthcare team about when it comes to recurrent pregnancy loss?
Yeah, I would just say just making sure everything has been tested, like looking a really deep dive into the thyroid. Sometimes they're only looking at TSH. We want to make sure T3, T4, your antibodies are tested. Really narrowing in on like ovulation, making sure that like PCOS has been completely ruled out. Endometriosis, there's nothing there. If there's any advanced testing that can be done there is like CA-125 is a cancer marker, but sometimes we'll run that as well to look at. It's not a specific cancer marker, which is convenient. It tells us kind of what's going on gynecologically as well too. So that can kind of give us a hint into maybe if endo is there as well. But ruling that out, metabolically, really deep dive into your insulin. Usually fertility clinics, they'll do like your HbA1c and their fasting glucose, but we also want to look into fasting insulin and making sure we're looking at that, or doing a 24-hour insulin collection there. Making sure your iron levels are really, really high. It's just clinically making sure everything has been crossed off and examined completely before we...
I might be putting you on the spot here, but so many people, and again, friends and people in the Oasis support groups, and like really have thrown the kitchen sink at it. And I know myself, like, I did intralipids. What are your feelings about intralipids? The infusions that they don't necessarily offer any improvements, but can't say that they don't.
Anything like that, I always say, if it doesn't hurt you clinically, then of course you can try it if we've got this kind of unexplained infertility there. Sometimes, like, really with that, there's no clinical evidence, right? We usually try to run off of more evidence-informed decision-making when it comes to prescribing things. Sometimes you have to go anecdotally, like this person has done this and it worked, right? So when you've hit that point in the fertility process where you maybe are at a time where nothing has worked and you don't know what else to do, then that's an avenue then, of course, explored if it might branch out into a clinical pregnancy, right? So not for it. Wouldn't say I would recommend it, but wouldn't recommend it at the same time. So kind of even keel there.
Makes sense. Thank you. Again, I put you on the spot with that, but I'm always curious people's opinions, honestly, like, because again, they're valued. So speaking of that though, is there anything like, what is one fertility / naturopathic myth you wish would like disappear? Is there anything out there that you just wish?
I think I wrote. I wrote this one down, so I had to think of it. Like one, I think I said it earlier too, one perfect fertility diet or one magic supplement that needs to kind of vanish there. There's so many. I avoid TikTok like the plague, but so many patients will come in like, I saw this on TikTok, or this doctor was talking about this and I just started it from that. And fertility is so much more complex than that. So I wish people would stop believing that if they're struggling to conceive, that they just simply need to try everything. And throw the kitchen sink at it. The other one is, now that I think too, back to our conversations a little bit earlier, but that you just simply need to relax. Stress. Relax and you'll get pregnant. Like, just stop trying and then you'll get pregnant, right? So many people say that. And stress can absolutely affect health, but when you are experiencing infertility, to just relax can feel like incredibly dismissive. So I hate
Not
that.
those words. Yes, we do
Yeah.
need to relax, but that
Yeah.
will not be the one and only thing that gets us pregnant. And
Yeah.
in conjunction with that, you talked a little bit about TikTok and those like social media advice and concerns. Do you think there's actually anywhere on social media that is beneficial, like in terms of fertility naturopathic care?
Yeah, I feel like there's a lot of really good NDs who put out a lot of great content. Just make sure it's like an accredited physician who's talking about that fertility recommendation. I always say to when making a clinical decision on like adding in a supplement, they'll talk about a study, right? They did this study and this person had this effect, right? And if you knew how to read the studies, just making sure they're like a good population size, or they're not funded by the company or the person who's advertising that product, right? So many different things that can affect that recommendation online. So just taking some time to do some background research if you see something come across the internet, or asking like your naturopathic doctor or your fertility specialist or family medical doctor about that before taking it. Because just because it's natural doesn't necessarily mean that it's not going to interact with maybe a medication that you're taking, or a concern or condition that you have medically. So,
And the key word is before.
yes, before even purchasing. I have some people who will purchase it and then bring it into the office, and I'm like, we're going to send it back.
Yeah.
We're not going to open that one.
Yeah, it's always good to ask questions. 100%. Ask questions, advocate. We're very big at that on that at Oasis. Like, ask those questions. We've had people, again, go to their doctors, how about this? I heard about this on this support group, or this person is doing this. What about me? Will it work for me? I think, or can we try it? Or what have you. But yes, making sure before you start, get the advice from those trusted people on your team, please.
Please.
So talking again, we've talked a little bit about like what happens when people come to you, and when optimally they should do that. But is there anything people should start doing, say today? If someone wants to start optimizing their fertility today through the naturopathic means, like what are the first 3 things you would recommend? And again, what questions would you recommend people going to see a naturopath should ask?
Right. Yeah. Both good questions to ask here. I would say first and foremost is know your cycle. A lot of women don't even know, like I was talking about earlier, kind of when they're ovulating. They're like, oh, my cycle comes every month. Okay, is it 28 days? Is it 30 days? What does your cycles kind of look like as far as the length there? How long
We're
are
not
you waiting
that.
for? Right? Yeah, a lot of women like just don't track their cycles, and getting like an app to do that, or literally writing down the date in your calendar, whatever works for you, but knowing your cycle and understanding when you're ovulating as well. If you're trying to conceive, that's the most important part of conception, is you have to ovulate. So testing, getting some LH test strips, and testing when you are ovulating and noting it. Because if we have a really short luteal phase, which is that second half of your cycle after you ovulate, that can be a reason why we're having some unexplained infertility there, right? So knowing where you're ovulating in your cycle, if you're ovulating really early or really late. So that would be probably the first one. The second, I would say, is just like look at your basics again. So go back to how are you eating? How are you moving your body? How are you sleeping? How stressed are you? How much alcohol are you consuming? How much coffee are you taking or drinking? Do you smoke? Maybe consider stopping that. and then what vitamins you're taking. So putting in like a prenatal during is the absolute basic. I would say we need a prenatal in there. And the
Folic
big
acid is not bad. It's great for your hair. Like, take your own time.
Yeah. I would say too, the prenatal, I didn't mention it earlier, but there are a lot of companies that have like the fertility specialists, when they recommend their products, will go through the ingredient list of that product too. So there are specific prenatals that are really dirty. They have a lot of fillers in them. So just making sure that the ingredient in that prenatal is literally just the ingredient of that prenatal, that's really important as well. I think there's one, I don't even remember the name of prenatals, but it had like shellac or red dye in it, yellow dyes. So you just want it super clean and nothing added extra in it. So that's important when you're thinking of supplementation. And then third, I guess, like know your medical history too. So surgical history, PCOS, endo, recurrent pregnancy loss, anything like that. Those are really important to know, medical and family history too. And then questions to ask your naturopath was kind of the second part, right? I would say, like, how does this differ from what my fertility clinic is doing? How do we know whether or not it's working?
That's a good one, right? Because
Yeah.
we can take all the things, all the supplements, we can change the diet, we can do all the things, but what are those signs of it working, right? That's the
Yeah.
outcome, not just, again, pregnancy, but what are you looking for in terms of a
Yeah.
successful outcome when we're switching lifestyles, right?
Exactly. And that's where like cycle tracking is really important because or LH testing, like some physical data.
Yeah.
Or lab testing, like we can actually see those thyroid values coming down or your iron going up, or we're getting an LH spike now, or your cycles are becoming more consistent every 28 days. Those are all like clinical things that we're looking for. So yeah, evidence.
I'm glad you brought that up. For sure, because that was again a big. Did have regular cycles. They were a little bit long, but still within that normal range, right? But I found they became more regular and a little bit shorter. And again, that ovulation was a little bit more predictable. So I'm one of those, again, people that had regular cycles and all those things, but there was signs of the PMOS. I've got to remember.
I know. I keep saying the PCOS.
Habit,
right?
I love that. And again, a little bit off script here, but do you see patients, like just female patients? Do you see couples together? And do you recommend that?
Yes. So majority of the time we're just seeing females, but I encourage the couples to come in. So if we are seeing a female patient on her own, I always say, can we have a conversation with your partner and try to get him to come into you for an assessment as well? Sometimes they sign up together too, which I would encourage if you're even thinking of conception in the next 6 to 12 months, because it takes 2 to tango when it comes to making a baby. So
is there any questions for those male patients you think they should be asking their naturopaths?
Yeah, usually their job is a little bit more just kind of cut and
straightforward.
Yeah, but yeah, just a good like sperm analysis should be done. So just asking for that, because oftentimes they won't run them. The fertility clinics are usually pretty good at that. So if the patient is going through that, then they'll do that there. But also like same factors too, just making sure we know the clinical evidence for the recommendation. I always tell my female patients, if you're starting prenatal, your partner is also starting prenatal at the same time. So they should be also on the same kind of supplement regimen. Obviously, the women are usually, well, not obviously, but the women usually are taking more. But they're also on usually omega-3s, and they're on vitamin D, and they're on a prenatal at the same time as the female. And there's other things that can be taken to kind of support sperm motility and morphology if the analysis does come back with showing some deficiencies there.
I'm really glad you brought up the analysis, because I find a lot of people go in, and that's, again, a very easy test, a very straightforward, simple test for men to have even a DNA frag done, where so often it's actually a little bit bananas, but people will still go to fertility clinics and start doing timed intercourse. They're monitoring women, maybe even IUIs, and the sperm hasn't really been fully investigated yet. And so it turns out that the sperm was really, there was numbers there, but it was garbage, right?
Yeah.
Or what have you. And again, there's lots of different things that I've heard come up in the support groups over the years, but having a stable, successful sperm analysis is really an easy first step in fertility, just to rule it out, right?
Yeah, exactly. It really does play a huge role in fertility. And it's so easy to help the male optimize it too, if that's the case. Or you might say, okay, you guys are probably not going to get pregnant naturally because of it. We need to move straight to IUI or IVF cycles as a result of that. It takes a lot of stress off the female too.
Yeah, absolutely. Again, easy tests. It's nice to again advocate for those things. So again, all those out there.
And I always say, if you think supporting your partner for a fertility test is something, going through a whole pregnancy and a delivery, your partner is your rock. So that fertility test is like a blip on the radar.
Right. Exactly. I love that. Is there any mistakes that you see people making when trying to optimize their fertility? Is there something that's too much maybe, or?
Yeah, I guess that over optimizing, they can be so focused on their fertility that they become afraid of coffee, or they go down to extremes of dieting, or they're over supplementing, tracking things really, really closely. So that can give them a bit of a health anxiety. So I would say that's the biggest mistake, trying to live a perfect lifestyle. I'm a naturopathic doctor, and I still have ice cream on the weekends. Pizza and wine is my favorite food group. So you have to live a normal life. I always say, if you can, especially in a fertility space, if you can live 80% of the time doing everything as close to right as you can, and 20% of the time enjoying life, then that's more than anyone can ask for, right? But yeah, that over optimizing is the biggest mistake I see.
Thank you so much for sharing that. Because again, people, I think, again, back in my day, I'm aging myself so much, but many, many years ago when I started fertility, it was that you needed to be perfect. And again, where's the joy if you can't have a glass of wine now and then, right? Where's the joy if you can't enjoy that piece of chocolate, or again, that bowl of ice cream every once in a while, or the pizza, whatever your thing is. It's okay to live life. And then again, I remember cutting out so much of it, and I was miserable. I'll tell you, already miserable going through treatment, and then add on to it, I can't have cake. That sucks. So again, thank you for sharing that. We can live life, and that's okay. And it's a really good thing to remember for fertility patients, because it's so easily forgotten when you're caught up in it. So.
And there's a lot of guilt that goes into patients as well. It's my birthday and I can't have cake. Of course you can. Have a whole cake.
Yes, exactly.
Enjoy it every now and then. It's important, but everything in moderation, and just trying to be as best you can, but you don't have to be perfect. That's for sure.
That's perfect. Thank you. I appreciate you saying that. We all need that reminder for sure. If you could give one piece of advice to someone who's been trying to conceive for a while and feels discouraged, what would it be?
Yeah, this was a big one, because I've felt it myself entirely when I was going through a fertility journey, but it's that you are not failing. I always thought, how can I not get pregnant, right? I'm a naturopathic doctor. I'm so healthy. I'm this athlete. My husband's an athlete. Like, how can my body be failing me right now? And it can make people feel like their body is betraying them, right? And everyone else around you is moving forward, especially in my age group. You see so many people getting pregnant around you or building these families so easily, or you hear somebody like, I got pregnant first try. But it's oftentimes not a reflection of how healthy or deserving or worthy you are. So yeah, just a reminder that you're not failing. Get some support that you need, ask all the questions, advocate for yourself, build your team around you, and give yourself permission to acknowledge that the fertility journey and the fertility process is incredibly hard if you're going through it. But don't blame yourself that way.
I love that so much. And this is why you're with the Oasis board, because that's what we do. We say, find your people. This is the worst club, but it has the best people. So come to a support group, find your people, come join us, because we will help you to advocate. We will help you with some questions. We have lovely experts that we can ask as well, and all the things. So that is a very excellent piece of advice for someone who's starting to feel discouraged. Please don't. You are perfect. You are doing all the things, and come find us, because we want to support you through that for sure.
Exactly.
Last question as we come to the end. We're almost done. Oh my goodness, it went so fast. What's one thing you wish every person knew before they started trying to conceive?
I would say fertility is something we should be thinking about even before you're ready to have a baby. So if you think that you might want a family at some point in the future, to think about your fertility and to look into it, not because everyone needs to be anxious about their fertility, but because understanding your cycle and knowing your medical history and just trying to be really helpful can give you more information and more options before you even decide to have a baby there. And I guess like the biggest message too is you don't have to do it perfectly too. So there's no like perfect fertility workup or perfect diet or perfect cycle. Just think of how you can best be healthy and understand your situation and get help when you need it there.
That's perfect. And I completely agree. My background is a teacher, and I just wish they would change the health curriculum a little bit to teach our teen, both boys and girls, a little bit more about their own fertility, because it's really important to when you come into fertility and you're surprised by things. And again, I've been out of my fertility journey, but again, I support people going through, and I'm still learning all the time. Things change all the time. So keeping people educated about those things is really, really important in knowing your health, your own health, your own body. For sure. Well, thank you so much, Caitlyn, for joining me today. This was so fun. So quickly, but you've answered everything so beautifully. And again, we appreciate your expertise, and we're so excited to have you on the board. And for those who are tuning in now or watching the replay, our next support group is coming up this Monday. So sign up in person for in-person groups, or virtual support groups. We're here to support. If you ever have any questions, you can reach out to Oasis or Dr. Caitlyn Keates. We'll be around. But thank you again so much, and we'll see you next time. Have a great evening, everyone. Thanks, Caitlyn.
You're welcome. Bye, everyone.